to our show, Your Health. Today we're going to be talking with Chris Gallaway. He is the Executive Director of Friends of Medicare in Edmonton, and he is here in Lethbridge for the 2025 Live Well Showcase at the LSCO, the Downtown Seniors Center. And Chris, so you've been here for just today and tomorrow. Tell us a little bit about what brought you down.
Well, we've come before, so it's great to be back for the expo here. Getting to talk to so many people, hundreds of people come through here to hear their concerns about healthcare and talk about the work we're doing to protect healthcare. And while we're in town, we do lots of other events as well, so it's just great to be back in Lethbridge. It's one of our largest cities in Alberta. We should care a lot about delivering healthcare here.
I think you and I are going to go out and talk to some people who are here at the Wellness Fair.
Yeah.
And see exactly what kinds of issues they have. And I know I talked to two people who said they're going to move to BC because the healthcare system here is not sufficient for their needs. This is Bernie.
Yeah.
Glenna. And Glenna. And
Nice to
Bernie's
meet you.
all mic'd up to talk to you.
Oh gosh, what are we going to talk about?
Actually, look, I just, number one, I wanted to know how to join your organization because if you could send a notification when you're having a protest or something, I'd like to go.
Yeah,
that's number one. Number two, this is my wife's pet peeve with the eye exams. All these new charges that are coming without any public input or nothing. Like we've had enough. If our premier wants to make changes, go to the public first.
Yeah, she promised she wouldn't delist things and then got elected and immediately did that. And it's a huge out-of-pocket cost.
We live in a seniors building, and it's not just us, we're all talking about it. So if you can pass the message on, enough is enough.
Yeah. Well, you should grab one of these. Yeah. It's our most recent newsletter. I think the eye exams are in there even. If that's the one, I forget which one it is. But if we have memberships, if you want to be a member, and then we also have an email list for folks who want to get notices of events and protests and things that are happening. So definitely sign that up.
I'm going to probably look at joining.
Yeah, and in the newsletter, there's the link. You can do it online too to join if you want to do it that way.
Good.
Yeah. What are you in is it a apartment, seniors apartment?
Yeah, we live in the Edwards building, right across from the main entrance to the hospital.
Oh yeah,
yeah. There's lots of us living there.
Yeah.
And all these surprise charges are getting to be ridiculous.
The driving exams too. They did that.
Besides that, what if I had to take on one of my kids?
Yeah. Right. It adds up.
$40.
Yeah. And it's preventative
And
care,
it's a surprise.
right? Yeah. People didn't realize it happened until they show up and get told, "Oh, that's not covered
That's
anymore."
what happened to me.
That's how you learn.
It's the whole healthcare. What I see happening, in all honesty, is they're breaking. It's just what's going on in the States. If we totally ruin it, then we can make what we want.
Yeah.
And I'll tell you one thing: if they totally ruin it, when they're out of office, they're going to spend the money rebuilding it all.
Yeah, it's going to be way more expensive after the
anyhow,
fact.
you can see I get going on this.
No, I like that. I like the passion.
I
It's
signed
nice
up
thing.
for the
You got them both on there?
email.
And yeah, if you want
yours on too.
and I don't know if the dental care program impacts you at all. There's the Canada Dental Care Plan. So the folks who get it, Danielle Smith's trying to take us out of it. So she's trying to opt Alberta out. So if you have that coverage, there's a campaign to stop her from doing that. Or if folks in your building, a lot of folks have, that's their only dental plan. Yeah, so just wanted to share that too in case it interests you.
There we go. Thanks,
Awesome.
guys.
Yeah,
Oh,
don't want
sorry,
his mic
no.
back. Nice meeting you. Hopefully see you again. Yeah, that's so good.
Yes, and Lethbridge has lots of problems with healthcare. We have lost so many doctors. We keep losing doctors on a regular basis. Earlier this year, we lost 2 doctors from the Campbell Clinic, actually right around Christmas time, and people were just absolutely devastated and trying to find doctors. I know some of the friends of mine who are older are really in extreme need and need to have their health monitored and couldn't find anyone. So this is something that's happening around the province, is it not?
It is something happening around the province, but it's something we hear here all day long. Talking to folks, one of the top concerns is the lack of a family doctor, and that impacts the emergency room in the hospital and those service disruptions as well. But since I've been in this role, I think it's been 4 years now, Lethbridge has struggled to have family doctors accepting patients. It's been the consistent top issue down here, and we had those doctors leave a few months ago that you mentioned, who very publicly said they were leaving because of the government, because of the chaos and uncertainty that they've created in healthcare, and that it wasn't worth staying in Alberta to practice. They would rather move to BC or elsewhere to be a family doctor, and that's something we need to recognize, that doctors are very portable. They can work anywhere they would like, and right now Alberta is not the place they're choosing to come to be a doctor. So we really need to turn that around so that folks in Lethbridge can actually get a family doctor. They don't go online, check the PCN, and be told no one's taking patients, check Medicine Hat, right? That shouldn't be the situation we have in one of our largest cities in the whole province.
Yes, and in particular, this is affecting seniors, because as you go on in life, you need more surgeries, and many people who need knee surgery or hip surgery are finding that the surgical intervention, their appointments are being postponed because of lack of anesthetists.
Well, and there's that domino effect. If you don't have a family physician, it delays your referrals, it delays your testing, it delays your ability to get into the queue for other care. And then once you're in that queue, the wait lists are getting longer and longer. It's impacting our hospitals. We saw just a few days ago new reports on Alberta emergency room wait times, and they're going up and up to unacceptable levels of hours and hours of average wait times. And part of that is the lack of primary care and family doctors. Alberta, when you look across the country, has the highest rate of patients going to an emergency room because they couldn't access care any other way.
The highest rate in all of Canada.
In Canada. As a percentage of our emergency room cases, it's folks who could have been dealt with at a primary care situation, a family doctor, a nurse practitioner, urgent care, some other way that folks could have been triaged before having to go to the emergency room. But the lack of access to a family doctor means they're going to the emergency room because they have no other choice. So that delays everything for everyone and is a very expensive way to provide simple, primary care, like prescriptions, antibiotics, medications, things that people should be able to get resolved without going to the hospital. But in Lethbridge, we're seeing that happen. And we're also seeing all summer long that there's a reduced capacity at the emergency room because of a lack of doctors. So we're going to see very long waits at the hospital, and a lot of those folks are waiting for care that they shouldn't have to go to the hospital to receive.
Well, in Lethbridge, we have another problem, and that is that our emergency room, sometimes we're down to one doctor working there.
Yeah.
I had to go to emergency in the fall, and luckily there were 3 doctors working at that time, so I was very fortunate. But I know this just came out recently, that as long as there's 2, they're in pretty good shape. But when we're down to 1, that really is terrible.
Yeah, it creates huge, long waits, and it's burning out our healthcare workers and our doctors because they're trying to keep the whole system going while short-staffed, and it's just going to lead to more and more staffing challenges as we burn people out if we don't find a way to retain folks and then recruit and train the people we need to actually keep the hospital and the whole healthcare system going.
Now, I've been talking to a lot of nurses here at this special Live Well showcase, and some of them told me that one of the problems in the surgical wards is the backup of where the people can go after they have surgeries, and that a lot of people who should be in long-term care are sitting in hospitals waiting for a place in long-term care, and so the system gets backed up, and that's also causing problems for surgical care.
Absolutely. We haven't built the beds we need, is the first thing. Our population has boomed in Alberta in the last few years. We haven't built new hospitals for decades in many of our cities. We haven't expanded them. So we're way behind the number of beds we need to serve. And then that's on top of that, it's the other types of care, like long-term care, like actually providing home care so people could go home if they need it. They're not set up for that, so they're stuck in a hospital waiting to go somewhere else, which fills up beds in the hospital. So it's those domino effects throughout the system where we haven't built the infrastructure we need, and then we don't have the healthcare workers we need to provide the care. And we've been underfunding for decades, that problem since Ralph Klein, really, till now. So it means people can't get into long-term care, they can't get out of the hospital, and it just keeps going back from there.
And he actually blew up a hospital, a perfectly functioning hospital. So that was sort of the beginning of this whole minimizing the infrastructure, so that then the government could say, well, we've got problems and we have to privatize.
Yeah, he closed beds, he blew up a hospital, he laid off healthcare workers, and then a few years later they say, oh, the system's not working, I guess we need to privatize it, it's not functional. Well, you broke it. That's intentional, and we're seeing that exact same strategy happen with Danielle Smith and the UCP now.
Yes, and recently something happened with our hospitals, so that Alberta Health Services is not just going to be providing the care, it won't be under our public health care system. Could you talk a little bit about that?
Absolutely. The government did a few things. They laid the groundwork in the recent spring budget that they were going to do this, and then as of April 1st, the government actually seized the titles to the land and the hospitals all across the province. They're no longer under Alberta Health Services. They're owned and controlled by the government. And they said at the time it was so they could control who gets to operate at those sites or how they'll be used. So really taking control of the infrastructure. And since then, we saw Bill 55 tabled and passed within a few days at the end of the spring session. It amends the Health Statutes Act, and it allows them to bring in private for-profit operators to run our public hospital infrastructure. They can now choose who will operate the hospitals. It's not a given that it'll be a public health agency controlling those. It could be a private corporation. Now, it's very scary, the groundwork they've laid for our public hospitals.
So our public hospitals, if they're operated by a private corporation, this means they could extra bill us for operations.
Yeah, they've actually amended the act with a whole section around fees and how people might be able to be charged. They've also amended it so decisions about people's care can be in the hands of administrators, especially in terms of discharging patients. You mentioned folks stuck in hospital seeking other care, long-term care. It'll now be up to an administrator, or it could be up to an administrator, there's different people who can do this, to say, no, we don't want you here anymore, you have to leave. And they don't have to discharge you to a care home or to another thing. They could just say, you're gone, go out onto the sidewalk, you're not profitable to have in the hospital anymore, so we want you gone. Right now, you need people with medical care deciding where you go, how you're discharged, when you're discharged. And now they're leaving it open that we could have a corporate-run hospital with a hospital administrator saying, we don't want you here anymore, you're too expensive to care for.
It seems like the government is going more towards that model of having people who are not medically trained making big decisions.
Yeah.
I realize now that AISH, people who are on AISH, according to the provincial government, will have to all be retested to see if they stay on AISH. But in the past, the people who are currently now on AISH have been tested by bona fide psychiatrists and medical doctors, and it's been shown they have their specific severe disabilities. But now with this new ADAP, is that what it's called?
Yeah, ADAP.
That's coming in. There's no indication of who would be doing the assessments or what the criteria are.
Yeah, it'll be government-chosen people who are doing the assessments, not your own medical professionals, doctors, and so on, who know your history, know your experience. You'll now be going through a pool of people the government decides to determine whether you're able to work or not, and then that'll determine if you get full benefits or not. So, AISH, folks living on AISH are already living in poverty often. It's not a robust program, especially in terms of housing, and now we're gonna see a whittling away of that through this, and they're doing that throughout the system. You look at addictions care, and addictions counselors aren't regulated here. They've created recovery coaches that have a few weeks of training at best that are providing care. In long-term care, everything's being downloaded onto healthcare aides rather than LPNs or RNs. It's that de-skilling because it's cheaper and more profitable when the private businesses come in to do the care.
Yes, and they're also liking to do things through AI or virtual.
Automated.
But there was a very good program for virtual care for people who had insulin resistance, and it was a 12-week program in 2022 to 2023. And this, I just interviewed a woman who had gone through this program. It was very good, but I can find no indication that this has continued.
Yeah, and virtual care, we're not opposed to virtual care. It should be part of our public health care system, right? With programs like that, where you're attached to a doctor, it's through public health care, not this TELUS health approach where they're charging you per appointment for some sort of access to care. It should be, to help people who need that type of care. Geographically, it can be helpful, but it should be attached to your doctor, the public healthcare system, to programs within the healthcare system, not these for-profit apps that we're seeing prop up, TELUS Health, Maple, but also all sorts of things around mental health or diabetes care, so on, where you get charged a fee or they get to own your health information after the fact, or these other concerns. It should be done through the healthcare system, and that was a great program. So we should be looking at expanding preventative care like that, and virtual care can help with that, but we're not seeing the evidence that that's the approach the government is going to go down.
Well, there's no money to be made if we prevent disease. Our system, our whole healthcare system, does not really seem to be based on health care. It's more like illness care, and there's a lot of money in illness care. I know people have been asking me, where can I find good information on how to live a healthy life? And it's very difficult when there are ads all the time for food which is actually bad for us, which increases our sugar levels, which makes us fatter. And yet we see the ads on the TV of the beautiful pizza baking in the oven and the cheese dripping off the pizza. And of course we see this and we're just
better get
salivating, like Pavlov's dog. We want to have this.
Absolutely, and we should be investing in things that will keep people healthier, those social determinants, including mental health in the healthcare system more robustly, but access to nutritionists, access to good information. Those are things we should be providing people, not once they're sick or trying to recover from something, but actually that's good information that actually helps people. Housing, so on. There's lots we could do to keep people healthy. Preventative care, like the diabetes program you mentioned, and things like eye exams, which the government has delisted from care, so people are now paying out of pocket. So we're nickel and diming people up front, and then they end up sicker down the road, rather than acknowledging that we could keep people healthier and it would help our healthcare system.
So we're planning to have a public rally in regard to Bill 53. That will be on June 14th. And by the time this is aired, that will be finished. But that bill was passed very quickly, and it was called the Compassionate Care Act. I talked with the Alberta Public Advocate for Health and asked her exactly what would happen under that system. Would a person who looks like they're addicted just be picked up by police off the street? And she said, no, this would be someone who goes into care continuously because they have some addiction problems. So I was very curious who will be in charge, and she told me it's not determined yet, but it could be a commissioner. Now, here again, we're at the situation of wondering what qualifications does the commissioner have, and how can we, the public, have input into making sure that someone in that powerful position to put people into a enforced treatment program, how can we make sure that person has good medical qualifications?
Yeah, we're very concerned about that act that was passed and rushed through that you mentioned. There was actually 19 bills passed in 6 weeks in this session, with closure used over and over, which means they limited debate to an hour over and over again to ram them through, passing them at 1 in the morning. It was a very aggressive agenda with not a lot of time to review those bills from when they were tabled till they're passed. But when you look at what they've done in Bill 53, this idea of forced treatment, right now there are options under the Mental Health Act that if someone is a risk to themselves or others, there is a process for medical restraint. It requires multiple doctors to evaluate and so on. This act around forced treatment, putting people into forced addictions care, which one, there's no evidence to support that care works. There's actually evidence to show people often die when they come out of it. But it's setting things up so it can be a police officer, a family member, and so on. It's not necessarily a medical decision to send someone into that, request someone be sent into that program. And it's not as limited as it is under the Mental Health Act, where after a certain number of hours. They have to reapply if they're going to try to keep someone. There's an appeal process and so on. Under Bill 53, we're looking at putting people away in specifically built facilities for forced treatment and keeping them there for weeks at a time, potentially against their will. It's a very concerning thing for human rights, but it's also concerning because it's not rooted in any evidence around care. And who will be able to do that? It shouldn't be up to a police officer or a family member to necessarily decide whether that's needed. We should have some medical support. We should have addictions counselors who are regulated in Alberta, providing addictions care and so on. And instead, we're seeing a very opposite approach where we're opening the door to non-medical folks to take away people's rights to freedom and choice. It's very concerning.
Now, I've been talking to some people here again at this wellness fair. I talked to a couple who had been in jail. They had each had addictions. I believe one to drugs and the other to alcohol. And they love this program. They think the Bill 53, they think it's the greatest thing since sliced bread, because when they were in jail, they were able to get off their addictions. So I said, well, what about the wraparound services? What about not going back to the exact same circumstance you were in prior, and you'll go back to that same community with the evidence showing that you could get right back into the same thing. They said, oh, no, it's fine. We got off it. So what do you think about that?
And that shows there's a spectrum of experiences in terms of addiction and how people are able to move past or live a life with those circumstances. It's not a one-size-fits-all approach, but the government is implementing a one-size-fits-all approach. We're not doing things like housing. We're not doing things like good mental health and addictions care up front. We regularly hear from parents or Albertans who seek out care for their addiction and are told it'll be 2 weeks. There's no spaces right now. There's no beds right now.
Right.
But then we're going to turn around and force you into a certain type of program in a certain facility saying, well, you must go recover now,
So
but
we
not
need-
providing the care you need up front.
So we need something right now. We need more facilities or more ability for people who want to self-care.
Refer, right?
Self-refer.
Yeah, folks have to be in a mindset that they're wanting to seek that out for it to be successful. There's a lot of evidence that shows that, but we hear it all the time. The folks come forward, they're like, I need some help, what can I do? And they're told, well, there's no spaces right now, we're full, right? Or you're calling around to different facilities because there's not a clear process to get in somewhere and so on. We haven't made it easy to access care when people seek it out, but we're putting a ton of money and resources and legislation in place to force people into a certain type of recovery program while not providing that when people seek it out, right? So we're addressing a problem without trying to address it first, but through one agenda, one size fits all.
And it looks like we don't have that support network for follow-up, sort of the halfway houses idea, or somewhere where you can be where the sellers of drugs can't get at you, because I know they go after people when they've come out of addiction, and they really put a lot of pressure on them. So there needs to be some safe places where they are away from that community.
Yeah, we need an actual plan for housing, transition housing, employment, these other things. Housing first used to be a thing we talked about quite a bit, that if we could get people stable, housed, we could have wraparound services and start helping with other issues. Instead, we're reversing that now, being like, we'll lock you up, we'll force you to recover, and then send you out into the world. Thanks so much, Bev, for having me on.
Thank you very much for including us in your agenda while you're down here.
Always happy to be in Lethbridge.
Thank you.
Great.